Basically, as a fertility specialist, having seen couples over past 20 years, what I have noticed is when a couple start deciding that, now we want to have a baby, that's the most joyous moment. It's butterflies in the stomach. You need to plan for a nursery, you plan for baby shower, you plan everything ahead, and then you decide that, yeah, now is the time I want to have a pregnancy. And this most often nowadays happens around 35 years of age. Unfortunately, the awareness of age and fertility is not much in the community, so usually women tend to decide on this a little later. And the expectation is also that the lady might conceive in a month or two. But unfortunately, we humans are quite infertile, and for us to have a pregnancy rate of at least 80%, it requires at least a year. And most of our women and men do not have so much patience. So as the month on month goes with a negative pregnancy report, it causes frustration, it causes a lot of loneliness, anxiety, and doubts, self-doubt on the body. Am I fine? Are my ovaries working? Is my uterus working? And things like that. So it's extremely important to be balanced, have regular exercise, have a good diet, have a good support system, meet other people and friends who are actually in the same journey, planning for a conception, educate yourself on the matters of fertility. That will give us a lot of insight to actually plan the pregnancy journey properly. So after a couple of months of trying, I have seen men and women getting extremely anxious, and that is where they start their medical journey. They seek out help, and there are times when, in spite of my repeated reassurance, they seek out for further tests and treatment. It's important that, especially when a lady is above 35 years, to seek help after 6 months, and less than 35 years to seek help after at least 1 year of trying. But however, before venturing into pregnancy, it's also important that they do something called as preconceptional tests. Preconceptional tests help us understand if the general health of the lady is fine, if she is adequately immune to rubella, because she is not, she needs a vaccine. And regular things like a hemoglobin, sugar, thyroid assessment. In addition to it, AMH assessment, just to know that the fertility is fine. So these things will help us reassure the couple. And in spite of reassurance, there are times when there is self-doubt. There are times when the repeated negativity over month on month can actually frustrate a person. This is true. And it's important that when such doubts arise, to learn more about fertility. So when pregnancy is not happening over months, it's absolutely okay to seek out minimal assistance treatments like ovulation monitoring. Now, this is a method wherein we can monitor the menstrual cycle and see when exactly the egg is releasing. This will help in enhancing the chances, even naturally, of achieving a conception. And while one is doing this, it's important to be part of support groups. Support groups are a fantastic way of, educating each other, spreading knowledge, learning more about what you're dealing with and what you're going through. At the same time, have open communications with friends, family, loved ones, with the doctor, for you to have crisp idea of where you are and how you should handle it. Social interactions and gatherings can be extremely challenging, especially baby showers or marriages or naming ceremonies of children can feel extremely painful for the lady to attend. Well-meaning comments from friends and family can actually appear extremely rude. And unfortunately, nobody else can actually measure the depth of pain or anxiety the lady is going through. And this in turn leads to more and more psychological challenges. What's very important for the couple, and particularly women, to understand is that she's not alone in this journey. There are several other women who are trying for pregnancy. So it's very important to make sure that you're part of a group wherein you can communicate and have open-ended conversations about the problems you're facing. At the same time, if you feel your mental health is going for a toss, make sure that you seek out help. It's also important that you talk to the medical specialist for you to understand if actually there's a problem and you need to deal with it. There are several and rather plenty of treatments now available. So it wouldn't be false if I can say that medical treatment at present has moved immensely over a period of time in achieving conception for infertility couples. For example, when I was actually studying fertility medicine way back in 2008, we used to talk of a pregnancy rate of 20%, and here we are 60%. So it has improved leaps and bounds, and it is blessing, I must say, for all women and men out there who are dealing with infertility. And hopefully, I think in another couple of decades, we should be at 100% pregnancy rate, and treatments would crack all the problems that are affecting the infertile couple. To conclude, I must say that, the fertility journey, or rather infertility journey, is a journey of immense emotional resilience. It is filled with a lot of heartaches, but also filled with a lot of support, love. It is a joy which is usually once in a lifetime joy, and nothing can match the joy of being a mother.